You talked about attacking waste and spending, but are you willing in this budget to also look at some of those key areas you've been talking about, in particular health and the NDIS, which may be vital but nevertheless are big cost areas? And secondly, you spoke about putting the finishing touches on the budget. Do you expect that anything you learn during your talks this week could change not the direction but make a big difference to how you frame the budget?
Thanks, Michelle. First of all, the budget will trim wasteful spending, and it will do that with an eye to making some room for these persistent structural pressures on the budget. In the health budget, aged care, National Disability Insurance Scheme, defence, our intention is to get maximum value for money in those areas. And to recognise that those pressures on the budget are intensifying rather than easing. And when your priority is providing a decent level of service and a decent level of care, then you need to look elsewhere in the budget to make room for that. So I wouldn't expect from us, some big cuts to spending in those areas. Really, why we raised them is to level with people about the pressures on the budget and the fact that some of the difficult decisions we have to take elsewhere in the budget, trimming some of this wasteful spending, is partly done with an eye to making sure that we can afford that. In terms of the finishing touches on the budget, I am prepared to update our understanding of the budget in the context of what we discuss over the course of the next few days in Washington, DC. The budget will be finalised when I get back. We already know in some areas, including the one that Phil asked me about, that we can expect substantial downgrades to the global growth outlook in the budget. If that requires some tweaking over the course of the next few days, then that would be normal for the Treasury to update their costings all the way up to when we have to finalise the budget.